I'm Dave Barnett. I'm the Chief Administrative Officer at DeVry University. We believe deeply in the idea that we can break the notion that there's a trade-off between quality care and cost. Healthcare's hard. Healthcare's complex. And so much of investment in healthcare at times goes toward things that aren't ultimately getting people toward the quality outcomes they need and deserve. The partnership with Transcarent has really been about empowering our employees to more effectively use a really complicated system. Moving into the AI platform for really helping to take care navigation to the next step is a no-brainer for us. We can help people engage with a tool that can give them on-demand 24/7 guidance around their benefits and clinical care. We think that helps people to really pivot and move in the right way to get the right care at the right time so that they can ultimately have a smoother journey, a higher quality journey, and reduce waste in the system. This last year, I think our ROI came from the fact that we had great engagement with the platform. Leaning into engagement matters so much. If people can more effectively engage with healthcare, they will have a better experience and it will keep our costs down. Transcarent can plan outreach the moment they need the intervention the most versus doing all those things at scale and broadly. When we talk about Transcarent financially, the results have spoken for themselves. DeVry has managed to see low single-digit year-over-year cost increases in our total benefits budget, beating trend by over 50% every single year. And so, yes, we made a bet. Yes, we took some work on the front end to sell the idea in, but it's paid off exponentially.